Well, good afternoon, everyone. Welcome to our Global Health Graduate Student Commencement. For those of you who don't know me, I'm Chris Byrer. I'm the director of the Duke Global Health Institute. This is my second graduation, so delighted to be here. And of course, we're delighted to see so many families and friends and supporters of these tremendous graduates today. I want to extend a warm welcome also to all the folks online who couldn't be here. We have an online component, so welcome, and we're delighted to have you with us as well. Today, we're honoring 26 students who are earning their Masters of Science in Global Health, and you're the 14th cohort to have gone through this program. 2 years ago, of course, when you arrived here, you arrived on a campus as the most diverse global health class we've ever had. Isn't that wonderful? Yeah, maybe that's an applause line. You are from 9 different countries, collectively speaking 18 different languages, and with a broad range of skills and perspectives. Some of you had clinical training in medicine, many did not. And a few had previous experience in global settings, while others were just beginning to explore this field and how to be a part of it. But what really united all of you is your passion and commitment to make a difference in the world. So that sense of purpose has allowed this group to forge really deep connections with each other and with our Duke community. This is a class that had each other's backs from day one. They studied together, they relaxed together, they faced challenges and struggles together, and they overcame an array of obstacles together. And today, they graduate together. So first, let me congratulate you all, Duke Class of 2024, for building such a strong and supportive community on your way to reaching this milestone. And could I ask the graduates to thank your family and friends and all the people who are here with you, please? Yeah. Many others, of course, have helped you arrive at this moment. Many of those folks are in the room. You've had the guidance and wisdom of our outstanding faculty and staff who have relished the opportunity to help you on this path. And you, of course, had friends and peers who've been there with timely advice and also for when you needed a break from the grind of this very demanding program. You've had the support of family and loved ones who gave you the tools and values you needed to succeed. And everyone in this room and everyone else who's been there to nurture and care for these outstanding young men and women, I want to share my most heartfelt thanks. I know these graduates are enormously grateful to all of you, and I speak for our faculty, staff, and colleagues when I say that we are too. It's been an absolute privilege to get to know some of you, most of you, over these 2 years, and to understand your ambitions and your values, and to encourage you on the path forward. Graduations are, of course, often times when we pause and reflect on what we've done and our achievements. And every one of these graduates has accomplished much in these 2 years for which they deserve to feel proud. You've taken difficult courses and mastered new skills. You've completed original research topics, including topics like HIV, cancer, cardiovascular disease, global mental health, surgical care, health systems financing. Collectively, you've participated in fieldwork in 12 countries, which is really wonderful, building relationships and trust in new communities, and often across differences in culture and in privilege. You've defined research theses and presented findings at international conferences, and all of these have required you to demonstrate critical thinking, diligence, and resilience that you may not have known you had. And you should absolutely cherish those moments as the landmark accomplishments they are. But it's also time to consider not just the place you're leaving, this Duke community and DGHI, but the world you're entering and how you want to show up in it. Graduations are equally about the person you're becoming and the standards that you promise to uphold as you move on to the next phase in your lives. This is why students graduating from medical schools all over the world are asked to recite the Hippocratic Oath. My old school, Johns Hopkins, graduates in public health repeated a Declaration of Health Rights at commencement. And these rituals are a way of reminding us that you are not leaving behind the things you've learned, but rather you're promising to carry them forward. And you're pledging to infuse your future careers, no matter what they may be, with the knowledge, skills, and values that you gained in the pursuit of your degree. These are testaments not only about what you've done, but what you will do with the degree that you've earned. So I'm not going to make you take an oath, okay? But before we move on to the rest of today's program, I do want to share a few thoughts on what a global health graduate might pledge to uphold, what you might all pledge to uphold. And what are those core values and principles that underlie your training and that I hope you carry with you as you leave us today? I think the first would always be to remember that access to healthcare is a human right. Health is not a privilege that should be afforded only to the rich or the powerful. It is the fundamental right of all people, no matter their resources or circumstances, to have access to health. I think when we understand this as a core principle of our work, we recognize our responsibility to call out unjust disparities in access to health care and to stand against those who would deny medical aid or services to anyone. This commitment also reminds us that it is inhumane to expect that those who bear the least responsibility for global challenges like climate change are expected to live with the worst of those consequences. So I think this commitment demands that we must always be working to dismantle inequitable structures and advance social justice. And social justice really is a part of global health. Second, I hope you remember that for a person to live in good health, they need so much more than just health care. Over the past 2 years, you've learned about the interconnections between the health of the community and its access to food, clean air and water, education and economic opportunity, and protection from discrimination and inequality. And so we as healthcare professionals need to be as committed to dealing with those social conditions as we are to treating illness or disease. He's learning to speak. It's a very important thing. He will be a student here someday as well. See a Duke's future. See a Duke's future. Okay. But even if your future work is not in healthcare, you can still advocate for attention to these structural elements as essential ingredients to the fundamental right to health. The next thing I want to say is that we all need to be, and all of you, I think, are going to need to be champions of evidence. We've all seen the pernicious impact of the deliberate spread of misinformation and disinformation about public health. And this is an epidemic that disproportionately affects vulnerable and marginalized communities and people with less access to information than all of you have had. As global health alumni, you now have to really process the tools to dismantle these false narratives and communicate the scientific grounding for public health. But you won't be able to use those tools without creating trust and room for dialogue with those who may disagree with you. So being an advocate for the evidence isn't about proving you're smart or belittling others. It's about the conviction that everyone deserves to benefit from scientific knowledge. Lastly, I think global health, if we had an oath, would include a pledge to always seek partnership with the communities you hope to serve. The late Paul Farmer, global health visionary and a Duke alum, once said, "With rare exceptions, all of the most important achievements you have on this planet will come from working with others." I think that's true. What this means is that you'll often be in positions where you have skills or knowledge to help solve a problem, but you will almost never be able to solve it on your own. No matter what your goals, you'll make a more lasting impact if you seek out the knowledge and perspectives of others, and especially those who don't have your power or privilege. And so those are a few things I hope you can commit to and uphold as you move on to the next great adventures of your lives. Defend health as a human right. Work to address the social determinants of health, be an advocate for sound evidence, and seek collaboration with humility and openness. If you continue to center these values in your work, we have no doubt you will accomplish much in helping to build a healthier, more equitable, and more just world. So let me close by saying that on behalf of our DJHI faculty and staff, our global partners, and your families and friends, we all congratulate you on your graduation. And we can't wait to see what you're going to do next. In just a moment, we're going to hear from our selected speakers. But before I introduce them, I just want to say a few housekeeping details. First, as I said, we have an audience watching online. So please do silence your cell phones and devices. And please try to keep out of this central aisle when the students are walking across the stage. Also, of course, we will have a reception out in the lobby for everyone. So families, friends, spouses, everybody's invited into the lobby immediately after the ceremony. But we also, you did the group photo already, right? Okay, we don't have to worry about the group photo. So we'll just go out to the reception. Now I have the pleasure of introducing our two next speakers, one faculty member and one student, who were nominated by our graduates today to reflect on this class and its extraordinary achievements. First, we're going to hear from Joe Egger, who is an associate professor of the practice of global health and DGI's director of graduate studies, and as of next year is going to be our director for educational programs. And then following Joe will be Prince Antwi, who represents the graduating class of 2024. Joe.
Thank you so much. Thank you, Chris. Welcome. Good afternoon. What a pleasure to be here. Thank you so much for giving me this opportunity to speak to you all. Welcome to family, to friends, to loved ones, to my DGHI colleagues. As Chris said, for the guests who I don't know, my name is Joe Egger. I'm a faculty member here at DGHI, and I had the pleasure of serving as the Director of Graduate Studies to these 26 extraordinary individuals who we celebrate here today. I want to give a particularly warm welcome and thanks to our Director for Academic Programs, Professor Mary Story. As many of you know, Mary is stepping down as director at the end of this academic year after a decade in this role. Our master's program in global health is truly one of the best in the world, and the success of our program is due in large part to Mary's vision and hard work over these last 10 years. Mary, thank you so much for everything you've done for me personally and for DGHI. And now to you, class of 2024. You are 26 people from 9 countries and 3 continents who came together 2 years ago, hoping and promising to both learn about the field of global health and to play a role in reducing health disparities and health inequities for people living in communities all over the world. During your 2 years with us, among many other things, you performed research to improve cardiac care in Tanzania. You worked to understand why social and behavioral factors increase mortality among preterm births. You worked to design interventions for young adults with type 2 diabetes in India. You studied ways to provide cervical cancer screening in Kenya. You studied the mental health of adolescents with HIV and those at risk of HIV. You assessed the surgical capacity to treat epilepsy in Uganda. You worked to understand how to finance and provide access to vaccines, including for COVID-19. You accomplished all of these things and so many others in your 2 years with us. I hope you are proud of this work. I am very proud of you all. And because of all of your hard work, all the long hours, the struggles, and the joyous moments you've experienced over the past 2 years, you've earned the right to say you are a global health graduate of Duke University. Congratulations. I hope that during your time in our program that you feel that you gained some practical skills, such as not only how to calculate a z-statistic, how to code interviews in vivo. There's a little bit of an inside story here, guys, for those of you who don't know. How to write a policy brief, how to conduct a case control study, the fantastical world that is ggplot, and even how to interpret the dreaded p-value. For those of you in the audience who are not familiar with the p-value, I promise to be very brief on this point. It is a statistic we generate in science to determine the degree to which we believe our findings are important. Interpreting them can be quite challenging, and I will admit I take some enjoyment in watching students struggle with this interpretation because I believe that this struggle is a symbol for one of the core values of global health. Let me explain. As many of you probably know, Dr. Hans Rosling was a Swedish physician and global health researcher and a strong positive advocate for global health. He became quite famous in his later years for clearly communicating global health trends and patterns with beautiful and dynamic graphics. If you haven't seen any of these graphs and figures, I encourage you to do so, that they really are extraordinary. He argued for an optimism of global health by reminding us all of the incredible gains we have made as a species. In just the last 25 years, for example, the proportion of the world's population living in extreme poverty has been cut in half. Over that same time, we have seen a significant reduction in malaria and HIV mortality, and the life expectancy on average across the world is about 70 years, whereas in the early 1800s, even in wealthy countries like Sweden and England, it was closer to 30 years. By many metrics, the world is a better place today than it has ever been, and that is due in large part to people like yourselves who have decided to dedicate their professional careers to continuing this fight to improve the world for us all. Hans Rosling wrote several books. His last is called Factfulness, and in that book he argues that humans often underestimate our successes in human development and global health. He believes that we fail to appreciate or even understand these large decreases in mortality and increases in life expectancy because we position ourselves outside of the problem. He calls this the gap instinct. The argument is that we, especially people from high-income countries, spend too much time talking about the imagined other and not enough time working with people and appreciating how similar we are or how small the gap between us often is. Just like with the p-value, we create binary worlds. We talk in terms of us versus them, good versus bad, right versus wrong, rich versus poor, north versus south, and yes, significant versus insignificant. In the case of the p-value, we observe something as nuanced as a probability distribution, and we want to use it to classify things as those that matter and those that don't matter. In global health, we appreciate that the world is rarely that simple. What this master's degree means to you is quite personal. I'm not going to tell you what it should mean to you, but I want to share with you what it means to me that you now have a graduate degree in global health. There are many different definitions of global health. To me, it is the interdisciplinary, collaborative, and collective pursuit of reducing disparities and improving the health of populations. We often use the word interdisciplinary in global health to acknowledge that we proudly draw knowledge and traditions from the humanities, the arts, engineering, the natural, social, and statistical sciences to help us make meaning of our world. We use the word collaborative because it takes teams of people working together from these disciplines to solve the biggest health problems facing humanity. But collective is my favorite descriptor of global health, because by using the word collective, we acknowledge the interdependence of our actions. We see human health as a shared vision. What benefits you benefits me. I see this way of thinking as a direct rebuke of the type of thinking that Hans Rosling criticizes in his books that continues to pervade our society. It counters the us versus them mentality that he describes and instead privileges ideas and practices that support a globalist view, a collective view of the world. I believe that seeing the world in this way helps us to develop a grace and sense of humility, that the way we come to understand the world around us may look different than the way someone else does. Viewing the world in this way will surely help us to address the many challenges we continue to face, such as the health effects of climate change, emerging corona and influenza viruses, and an epidemic of mental health, to name just a few. I believe that global health is a verb as well as a noun. It is a pursuit, it is a process. It is a set of guiding principles as much as it is a set of technical skills. I hope that we prepared you well for the next chapter of your career, wherever that may take you. And I urge you not to succumb to the binary view the world wants from us. We are not working to solve other people's health problems. We are a collective of people working to solve our problems. In global health, we believe we can make a difference together. I believe that you can make a difference. I believe that you will make a difference. Good luck, and thank you for letting me and all of us at DJHI be a part of your journey, and congratulations on this extraordinary accomplishment. Thank you. And now I would like to introduce and welcome our student speaker, Prince Antwi, to the podium. Prince.
Good afternoon, everyone. My name is Prince Antwi. I am a member of DGHI's Masters in Global Health, class of 2024. And I can't thank my classmates enough for giving me the honor to speak on our special day. Please let me congratulate our class on making it to commencement. It's been no easy journey over the last 2 years. Friends, we have cause to celebrate this accomplishment. But none of this would be possible without our support systems, to whom we are deeply indebted. Our DGHI faculty and staff cannot be thanked enough for the immeasurable effort they've put into training us over the last 2 years. The education team has poured countless hours into ensuring that we could make it this far and graduate from the program. Personally, I would like to appreciate Dr. Nate Thielman and Tara Pemble from the Global Health Pathway, which provided the opportunity for me to take part in this program as a resident physician. To you all, my colleagues and I appreciate your efforts and hope we can count on your continued support as we embark on the next phases of our careers in global health. Similarly, we are surrounded by friends and relatives who have been instrumental during our time here at Duke. Class of 2024, will you kindly join me in clapping in appreciation of our loved ones who have supported us? Thank you. On a personal level, permit me to honor my wife, Mrs. Amayanchi, and my daughters, without whose immense support I could not pursue neurosurgery residency and global health interests concurrently. As a neurosurgery resident, much of my training focuses on caring for the individual patient before me. That's undoubtedly important, but quite clearly, taking out one patient's brain tumor or decompressing one patient's spine goes a very little way to impact the health of all humanity. That's what drove me to incorporate global health into my training and career. We are told that 5 billion people in our world today do not have access to safe, affordable surgical and anesthesia care. The vast majority of these individuals live in low and middle income countries. Like each one of my classmates, I dream of a day when that gap will be vastly reduced. I spent last summer in Kampala, Uganda, assessing the need for epilepsy surgery in that country and identifying actionable steps that can be taken to make surgery a feasible option for individuals with medication refractory epilepsy. Friends, that gap in global surgical care is only one of the global health challenges that await us as we leave Trent Hall. In Dr. Yemi's class, we came face to face with global health inequities, the inequity of vaccine distribution during the COVID-19 pandemic being a clear case study. In Dr. Oboji's class, we learned of the deficiencies in health policies and systems that contribute to large sections of our populations having inadequate health insurance, the drain of health workforce from low and middle income countries into high income countries, and often challenging relationships between political leadership and health delivery. Between lectures and case studies and discussion boards and debates, we were made conversant with the global health challenges of our day and called upon to propose solutions to these challenges. Probably more tangible were our respective fieldworks, which brought each one of us in close proximity to the threats to the health of fellow humans, particularly those who live in less resource settings. We could take turns narrating stories of the health system inadequacies and inequities that each one of us witnessed during our graduate research work at home or abroad. I arrived in Kampala at a time when most physicians in the public health system were on strike, exposing some of the fault lines within that nation's health system. Colleagues, there are a few ways we can respond to these inequities. We can graduate from DGHI today and go on with the rest of our lives as though we were unaware of these inequities, but none of us enrolled in this program simply because we wanted to witness a due graduation. We committed years of our lives to learning and training here for a purpose. In whatever small or large ways we want to contribute in solving the health challenges of our day. This generation of global health practitioners is responsible for solving this generation's global health inequities. I want to collaborate with others in introducing innovative surgical treatment options for diseases that rob the fullness of the lives of many across sub-Saharan Africa. Others of you yearn to advocate for underserved people groups and multilateral organizations, yet others seek to influence policies that make the workplace safer, medical care more affordable, or preserve the integrity of our climate. These were the ambitions that sent us to DGHI in the first place. That's why today is a commencement, not a finish line. I propose we take stock of the tools and values and relationships we've nurtured over the last 2 years and begin to weave them together into effective solutions towards the global health challenges of our days. The challenges are different and our contributions will look different, but certainly each one of us has developed a skill or two or more that could prove invaluable in improving equitable health across our globe. Please don't hold back your skills. Like each one of us gathered here, I recognize the enormity of the charge ahead of global health practitioners in our century. I certainly do not reduce them to simple tasks that can be easily solved with the knowledge and skills that we gathered over the last 2 years. But I'm even more certain that the only way any problem gets solved is by someone being daring enough to approach it with whatever limited skills or tools or resources that are available. When my mentor, Dr. Mike Hagland, initially arrived in Uganda more than a decade ago, the nation's largest hospital had almost no capacity to provide neurosurgical care. Instead of throwing in the towel, he worked alongside Ugandan colleagues to build the first neurosurgical training program in Uganda, and now local neurosurgeons run the program independently with commendable results. Similar testimonies can be given to the works of several of our faculty who are sitting before us today. In diverse ways, they've taken on global health inequities and made great progress through their research and writings and inventions and advocacy and leadership and, of course, their teaching. The challenge will always remain impossible until you and I confront it. In light of this class of 2024, let us commence. Let us commence on the mission and vision that drove us to this place in the first order, to work alongside each other in achieving health equity both at home and abroad. I pray God blesses each one of our journeys in global health and make them fruitful. Congratulations.
Thank you, Prince, for those inspiring words and for being such a valued member of this graduating class. My congratulations to you and your fellow graduates for your remarkable achievements over the past 2 years. I'm Mary Story, a professor here at DGHI and also director for our academic programs. And today I have the wonderful pleasure of presenting our student and faculty awards. And let me say, with so many outstanding students and professors in this program, it's so challenging to choose just one student and one professor for this honor. We're privileged to work in a community and an environment where excellence abounds. But the two individuals we're going to honor today are truly exemplary for their talent, effort, and passion for global health. So our first award is the Madeline Bacuzzi Outstanding Graduate Student Award. This award is named in honor of Madeline Bacuzzi, who graduated from our program in 2013 and was unanimously chosen as the most outstanding student that year. Tragically, a year later, Madeline died from cancer, but during her lifetime, she exemplified the spirit and dedication that this award recognizes. And we're really proud to continue to celebrate her legacy by presenting this award in her honor. So for this award, we ask our faculty to nominate students who they believe excelled in the classroom, in collaborative research, and in building the global health community at Duke and beyond. We received many glowing nominations, and it's clear that this class has many outstanding students with worthy achievements. This year's outstanding graduate student is someone who's rarely chosen an easy path for herself in her academic journey at Duke, but her impressive work ethic, personal tenacity, and deep compassion have allowed her to stand out as an exemplary learner and global health researcher. Her thesis research project focused on surgical outcomes for pediatric patients in Tanzania and is a good example of her determination. She was the first DGHI student to work in this particular site, and she had to hire and train a local team to complete the data collection. Her advisors say she met these field challenges with enthusiasm, embracing the opportunity to grow not only as a researcher, but also team leader. And one of her team members wrote, "Her meticulous approach to data collection and analysis yield valuable insights that significantly contributed to our project's success. But equally important are the respect and solidarity she brings to her work. As one of her advisors noted, I never had to teach those qualities. They are simply intrinsic to who she is." During her last 2 years with us, the student has written 5 research papers that have been submitted to high-impact journals and has presented research at several conferences. She was also a Global Health Policy Fellow in the Geneva program and a teaching assistant for our largest undergraduate course, Fundamentals of Global Health. But according to people who nominated her for this award, all these accomplishments flow from her desire to make a difference and achieve health equity for the poorest of the poor. As her advisor sums it up, without question, she is the brightest and most academically able person that I've worked with in my 14-year career in academic research and global health. She can match her leadership skills and academic abilities with kindness to motivate others towards a common goal. For all these reasons, we are proud to present this year's Madeline Bacuzzi Outstanding Graduate Student Award to Pamela Espinoza Gonzalez. And now we present the second award, the Graduate Health Graduate Professor of the Year Award. We're so fortunate to have a remarkable group of professors and mentors inspiring students like Pamela and her classmates to achieve the great work they do. These professors teach the 6 required core courses in the Masters of Science curricula and also several electives across campus. They also serve as research mentors for our students, helping them design and carry out their research projects that often involve multiple global partners and complex research methods. Each year, we ask students to put forth nominations to recognize a faculty member who has gone above and beyond to teach, mentor, and support our students. This year's outstanding professor has been praised for his exceptional mentorship and inclusive approach in the classroom. He teaches a course for the DJHI Master's Program on Global Mental Health, which is an increasingly important topic in our field and one that many of our students have an interest in exploring. While such a broad topic could easily become overwhelming or intimidating for our students, the broad area of global mental health, this professor presents material in a way that students describe as focused, engaging, and intellectually stimulating. Building off his own research, which focuses on stigma faced by people living with HIV, this professor's lectures explore the social and cultural factors that influence mental health, allowing students to explore the topic from multiple perspectives. As one student noticed, the class pushed me to think outside the box, fostering a mindset of respecting and learning from diverse perspectives. Students also appreciated the personal attention and support they received while taking the course. As one student who worked as a teaching assistant in this course commented, "I have witnessed firsthand the transformative impact this professor has had on his students." So I am pleased to present this year's Global Health Graduate Professor of the Year Award to Dr. Brandon Knettel. I just want to say that Brandon is an assistant professor of nursing and global health and co-director of the Duke Center for Global Mental Health. So congratulations. These awards are also not told to the awardee in advance. So Brandon just said he would have worn a suit if he had known. Congratulations to our award winners, and thank you for your outstanding contributions to our community and our education program. And now it's time to honor our graduates, and so I will let Laura Bai come to the stage to kick off the ceremony.
So good afternoon. My name is Laura Bai. I'm DGHI's Senior Associate Director for Academic and Student Affairs. And before we recognize our illustrious graduates, we'd like to honor just one more person, Dr. Mary Story. She is our current director of all DGHI academic programs, and she'll soon be stepping down, as you may have heard, after 10 years in this role. So I could tell you all about Dr. Story's prolific research and publication record, resulting in over 450 articles and 40 book chapters. makes me tired just saying that. Chapters on nutrition and childhood obesity, her Lifetime and Achievement Awards given by the American Society for Nutrition, the Obesity Society, and the Society for Nutrition Education and Behavior, just to name a few. Or her service as an expert on numerous committees examining nutrition standards for federal programs and food marketing. These are just a few of Dr. Story's extraordinary accomplishments as a scholar, but what I really want to highlight for you is her vision and leadership in guiding our education programs. Okay. She strives for, excuse me. She strives for and supports others in creating education programs of excellence. 10 years has been a long time. Sorry. Dr. Story champions the strengths of those around her and leads with kindness and optimism. Oh, wait, and did I mention that she runs a really good meeting, which is not a skill to be undervalued? So Mary's work and vision has had a profound impact on DGHI's education programs. Mary has hired global health faculty who taught these students, and she shaped the education team staff who work so closely with them. The results of Mary's work can be seen right here in this class. Through creativity and innovation, she expanded the pathways through the program to include internships, an accelerated master's program, and collaboration with partners across Duke and Durham, all to the benefit of these students. So Mary, on behalf of the education team, I'd like to present you with this award in recognition of your outstanding leadership and service to our students. Okay, and now the fun part. Now it's my pleasure to present our 2024 graduates. Each of our students will walk across the stage as I read their name, and I just want to remind you, we do have people watching the ceremony online, so please refrain from using the middle aisle so our audience can clearly see the stage. We have a photographer capturing pictures of this moment, and those photos will be made available to all of you a few days after the ceremony. So, as we're getting ready here, let's begin. Chinene Agina. Jen explored the peer group leader experience of delivering a mental health intervention for adolescents living with HIV in Tanzania. Her mentor was Dorothy Dow. Prince Antwi. Prince's thesis was a mixed method approach to assessing the need capacity for epilepsy surgery in Uganda. His mentor was Mike Hagland. Brianda Barrera Overa. Bree worked with David Eagle to understand the challenge of depressive symptoms among seminarians. Parker Betts. Parker's mentor was Joe Edgar, and together they studied how self-efficacy and perceived risk of HIV influenced HIV testing avoidance among adolescents in Tanzania. Elsie Bergen. Elsie evaluated the implementation of a two-tiered family therapy intervention through participant perspectives in Western Kenya. Her mentor was Eve Puffer. Bologna. Impression on the effectiveness of an intervention in reducing harmful alcohol use in Moshi, Tanzania. Her mentor was Catherine Staten. Mung Chen. Studied chronic pain and depression among cancer survivors. Her mentor was Nosa Osazua Peters. Purity Chepkowicz. Purity examined client-centered approaches to improve cervical cancer prevention outcomes in Kisumu, Kenya. Her mentor was Megan Hutchko. Winifred Edom. Winifred investigated Nigeria's progress towards self-financing and an analysis of the financing of routine immunization vaccines. Her mentor was Osandu Okwoji. Pamela Espinoza. Pamela analyzed the epidemiology and outcomes of pediatric surgical patients at a tertiary hospital in northern Tanzania. Her mentor was Emily Smith. Lorena Garcia Boches. Lorena completed a pre-implementation study of physician knowledge, attitudes, and perceptions of facility-wide antibiograms in southern Sri Lanka. Her mentor was Gayani Tilakaratne. Kalipa Kasuza. Kalipa worked with Julian Hertz to conduct a prospective observational study of inpatient myocardial infarction care in northern Tanzania. Emily Klein. Emily's thesis assessed the effectiveness of HEPA filters in Los Angeles, California. Her mentor was Jim Zhang. Mengqi Li. Mengqi's thesis was a comparative assessment of 3 time-use methods using data from 4 sub-Saharan countries. Her mentor was Jim Zhang. Nguyen Thuzar Nguyen. Nguyen worked at the University Research Corporation with Lonnie Marquez, where she evaluated a project management and leadership training program to identify best practices in global health knowledge management. Hannah Metzger. Hannah's thesis was a Shanghai birth cohort study centered on the epigenetic implications of chronic PFOA exposure. Her mentors were Lai Ping Feng and Jim Zhang. Madeline Metcalf. Madeline's thesis, entitled "It's His Cheerfulness That Gives Me Hope," was a qualitative analysis of access to pediatric cancer care in northern Tanzania. Her mentor was Emily Smith. Fatima Miraj. Fatima conducted a mixed methods study to understand the determinants of mortality in preterm babies. Her mentor was Osandu Agwoji. Hong Pham. Hong surveyed pediatric cancer survivors in Mwanza, Tanzania to evaluate perceived and experienced stigma. Her mentor was Kristen Schrader. Joshua Serafian. Joshua worked with Julian Hertz to determine the prognosis of patients with nonspecific electrocardiogram findings in the Tanzanian emergency department. Ismail Shakibullah. Ismail developed a qualitative study exploring the context of suicidal ideation among people living with HIV in Kilimanjaro, Tanzania. His mentor is Brandon Nettle. Jordan Swendell. Jordan evaluated a gun violence listening intervention program in Durham, North Carolina. His mentor was Henry Rice. And this completes our 2024 graduating class. As our students are making their way back to their seats, I'd like to note a few things. First, if you came through the front entrance today, you probably noticed the banners in front of the building. And those banners reflect DGHI's core values: humility, compassion, respect, cultural sensitivity, collaboration, diversity and inclusion, and a commitment to impact. This class has worked hard to uphold these values during their time here, and graduates, I encourage you to continue to embrace them going forward. Second, I'd ask everyone to remain seated as our graduates leave the hall. Once they've exited, please join us in the atrium for a reception. And so for one final time, class of 2024, congratulations from all of us at the Duke Global Health Institute. Graduates, please rise, and we'll begin the procession. And thank you all for celebrating with us today.